Hello viewers, my name is Jacqueline Anundo. I'm the Training and Research Manager at Chiromo Mental Health Hospital. By training, I'm doing my doctorate in clinical psychology, and I'm a member of Clinical Psychologists Association of Kenya. I'm also a member of Kenya Psychiatric Association and also a member of ISAP Kenya for Addiction Professionals. Today, I'm here to talk about gender-based violence. And gender-based violence, these are some of the cases that we've been getting a lot at the hospital. So what do we mean when you talk about gender-based violence? Gender-based violence refers to violence that is directed to an individual based on his or her gender. Then we also have another form of GBV known as intimate partner violence. And this is the most common form of GBV. It includes physical, sexual, and emotional abuse. It could also include controlling behaviors by a current or even a former intimate partner or even a spouse. It can occur in heterosexual or even in same-sex couples. Then you also have another form that is domestic violence. This is the kind of violence that is meted out by partners or family members on an individual. We have various types of GBV. One of them is sexual abuse. The other one is physical abuse, forced marriage. It could also come in the form of denial of resources, opportunities, or even services. It could also be as a form of psychological or emotional abuse. It could also come in the form of stalking someone or controlling behaviors. So you find that violence is not something that somebody just wakes up and it starts. It follows a certain cycle. So this cycle starts with what we call the honeymoon phase. In the honeymoon phase, you find that the abuser may show some signs of jealousy, which makes the victim to feel, or the survivor to feel, very special and important. At this point, there's no abuse that is taking place, and everything seems as if it's normal and everything is okay, except for the jealousy that the abuser is showing. At this point also, the abuser may also give gifts to this particular individual. Then it moves to the next phase. This is the tension building phase. In this phase, stress builds from pressures of daily life, like conflict over children, marital issues, misunderstanding, other family conflicts, or even coping with the pandemic itself. So the abuser in this particular case feels ignored, threatened, misunderstood, may feel annoyed, may feel wronged, and because the abuser feels this way because of this piling tension, because of all these conflicts that is going on around this person. Remember, during this COVID period, there are people who have also lost their jobs, so that could also be one of the conflicts that the family is facing. So you find that here victims may feel like they are walking on eggshells around the person, because anything that they say, anything small that they say may be able to trigger either a physical abuse or some, the person may hurl hurting words at this particular individual. Then after the tension stage, it moves to the explosive phase. Now, this is where now all the tension that has been building up will be released, and it can be released in various ways. It can be released in the form of beating up this person, pushing, choking this particular individual. It could also include sexual violence towards this particular individual. So basically, this is where now the abuse, the physical, the sexual, the emotional abuse now takes place. Now, you also find that the victim at this stage will also have a lot of bruises, broken bones, broken limbs, and may end up in hospital. Sometimes at this stage also the police may be involved. Then from explosive stage, it moves to reconciliation stage. Here the abuser apologizes and begs the victim to believe the violence won't happen again, blames this particular individual for the abuse. If you didn't do this, then I wouldn't have slapped you. If you didn't do this, then I wouldn't have done what I did. You are the one who keeps on provoking me. So this particular survivor now becomes very vulnerable and tends to accept the abuser's apology. Then again, it moves to the phase where I started, the honeymoon phase. And then the cycle continues over and over and over. Honeymoon, tension, explosive phase, reconciliation. So it's something that is going to be going on over and over until an intervention is done. When you look at statistics that have been reported on gender-based violence, you find that worldwide, almost 30% of all women who have been in a relationship have experienced one form of violence or another by their intimate partner. Now, it has been reported that Kenya has some of the highest rates of violence against women in the world. The studies shows that 1 in 3 Kenyan females experience an episode of sexual violence before the age of 18. The Kenya Demographic Health Survey also shows that, and this was the one that I'm referring to, the one that was done in 2014, shows that 45% of women aged 15 to 49 years have experienced either physical or sexual violence. So you find that more than 41% of Kenyan women have experienced one form of violence or another. Now, I'm talking about women. You will ask, where are the men? In other studies, it also shows that 90% of reported cases, yes, men are the perpetrators. However, these studies also show that 1 in every 5 Kenyan males have experienced an episode of either physical or sexual violence. The only reason why the statistics are a bit low is because most of these cases are not reported, or they are reported as other forms, but not gender-based violence. So by the time they are picked to be gender-based violence, you find that a lot of issues have come up. Now, in April this year, Chief Justice David Maraga reported that in January alone, we had 50 cases of gender-based violence. In February, the cases went to 62. Now, in March, when we had the lockdown, the cases went up to 106. Currently, the cases have tripled. And your guess is as good as mine of what the statistics are currently. So I find that these cases have gone up during this COVID period. Why have they gone up during this period? Is it because people are locked down together in one environment and they don't know how to cope with the conflicts that are arising? So what could be happening? You also find that these cases are not only unique to Kenya, even worldwide. It has been reported by United Nations that 1 in 3 women experience domestic violence. However, during COVID, from March this year, the rates have been equated to be 2 in 3 to be experiencing gender-based violence. And this goes for both men and women. In the US alone, the cases have gone up between 6% and 22%. In India and United Kingdom, 25%. In Spain, 47%. And these are very current studies. In Netherlands, we also have 50%, especially during the surge was reported more during this lockdown. Now, in China, it has been reported that the cases are at 90%. In Denmark, they have reported more men who have become homeless because of conflicts in relationships during this COVID-19 pandemic. So that tells you that the prevalence of gender-based violence has gone up with the COVID. And we need to understand, we need to address the question, why has it gone up? Or is it that it was not reported before? Or is it that it has now escalated during this COVID period? What are some of the causes of gender-based violence? Gender-based violence can occur due to one's upbringing. How were you brought up? How did you see conflicts being resolved in your family? Were they resolved in an aggressive manner? If that is the way they were resolved, then this child will grow up also knowing that conflicts are supposed to be resolved in an aggressive manner. What about your culture? What does your culture say about gender-based violence? What are some of the issues that come up, especially when there's violence in the family? Is it tolerated? How is it handled? Issues of substance abuse, which have also been on the rise during this COVID period, have also made gender-based violence cases more. Religion also comes in a relationship. Which religion do partners follow? Is that something that is discussed so that it doesn't bring conflict? Because that has also been found to be a source of conflict. Do you follow religion for your spouse, or do each one of you go to their own respective religion? Then, another cause is mental disorders. There are some mental illnesses that predispose someone to either be a victim or to be a perpetrator. Then you also find that people with low self-esteem have also been very vulnerable to gender-based violence, because these are people who are not assertive enough. They cannot say no. They cannot speak up for themselves. And you find that such people are very vulnerable to violence. Then there's also the issue of poor anger management skills. How do you manage your anger? When you're angry, do you walk away from the situation and address it later, or do you become aggressive when you're angry? So how you manage your anger also matters a lot, because it shows whether you're likely to be violent or not. Then also there's the differences in literacy levels. It has been shown that when couples have different literacy levels, then there are high chances of there being more violent cases within the relationship. Other studies have also shown that couples with same literacy levels have also had their own share of violence. But with all this, there are certain consequences that people experience. One of the consequences is that when partner abuse of pregnant women has been associated with preterm deliveries of low birth weight babies, or even intrauterine fetal death. Now, being victims of child abuse as children and of intimate partner violence as adults also puts children at higher risk of having poor academic performance, emotional problems, and even engaging in substance abuse. GBV can also cause serious physical injuries or even death. Sometimes we've had cases whereby someone has picked a blunt object and hit the other, or someone, as a way of self-defense, has hit the other with an object, and that has led to their death, leading to now a criminal case. Now, the fatalities in GBV have risen in the recent past, especially during this COVID period. Maternal mortality has also gone up. HIV-related deaths have also gone up. Issues of substance abuse have also gone up. So when someone is going through this, how do this person present when they come to us in the hospital? And what do we do as mental health care workers? The first thing that we do is to take history, because this is very key. We need to note down what could be happening to this person. And remember, most of the time, the survivor, the person who has been battered, and the perpetrator, they normally come together to the hospital. So when they come together to the hospital, you find that in most cases, it is the perpetrator answering the questions that we are asking. So it's also important to be able to note who is answering the questions. Is it the patient who has come to hospital, or is it the person who has brought this person? So it's also important to get also answers from the patient himself or herself. We have also had women who accompany men to the hospital, and they're the ones who have battered these men. So most perpetrators will not want to leave the patient alone, and it's important for now the mental health care worker to ensure that they're able to take history also with the patient alone. It's also important to be able to note acute injuries to the head, the face, or any part of the body, because these reports are very, very crucial to determine the kind of care that this person is going to be given. Then after taking the history, it's also important to be able to make the person to feel very comfortable, because remember, most GBV survivors, their world is lonely, isolated, and filled with a lot of fear. So it's important to ensure that this person feels safe in order to trust you enough, in order to be able to open up. So it's also important that even before this person comes to hospital, if you are a friend to one, a relative to one who is going through this kind of violence, it's important to reach out and let them know that you are there for them and that you can be able to provide support for them, so that even by the time they are coming to the hospital, and we also do the same, then we are giving them an environment to feel very secure, to feel very safe, to open up. Remember, GBV survivors may often feel misunderstood and unsupported, especially when they come to hospital and they have a mental illness. And you find that maybe me as a mental health care worker, I'm concentrating on the mental illness and ignoring the violence that they have gone through. So they may feel that I'm attaching a lot of importance to the mental illness as opposed to to what they are going through. So it's important for healthcare workers to ensure that they don't label survivors with the psychiatric conditions that they may be diagnosed with. Instead, they should also help this person understand that they feel supported, they feel understood by focusing on the problem. Otherwise, that will lead to mistrust, and this person may not be able to open up. When handling GBV survivors, also it's important to use a model, because we have a model that guides us into how we are able to help these particular patients. Safety, it's important to ensure that the victim or the survivor feels very safe around the environment, around you, the practitioner. Then give this patient choices, yeah? Help this patient to make a choice on what to do about, their condition. So you need to provide a clear and appropriate message about their rights and responsibilities. You're not coercing them or pushing them into doing something. You're just helping them to make choices about their condition. Collaborate with them. It's also important to ensure that they trust you. How do they trust you? Ensure that you're very clear in your tasks. Be very consistent. Be very respectful. Observe the boundaries of the profession. And then it's also important to empower these people. Provide an atmosphere that allows the individual to feel validated and affirmed with each and every contact at the agency. Remember, I said in the beginning that a GBV survivor lives in a very isolated, lonely world, a world that is filled with fear. So when you empower this person will feel that this is a safe world for me to be able to open up. So when it comes to the role of mental health practitioners, it's important to screen and assess for GBV during routine medical and mental health care visits. Why do I say this? Because most people, when they come to the hospital, they will not outrightly say that I'm being violated, I'm being abused. They will bring in many other stories, and they will not come out straight to say exactly what has happened. Even if you see them with a black eye, they may tell you that I fell on the stairs, I hit myself in the bathroom when I was showering. They'll give you all sorts of excuses, but they will not come out and say clearly what is happening to them because of that intense fear that they have lived with. If there are any signs and symptoms that raise concern, it's important to ensure that the patient is screened privately and alone, without the person who has brought the person to hospital. If an interpreter is needed, then it's also important to be able to ensure that the interpreter is a person who will ensure, one, confidentiality, who will ensure that this person feels safe, and it's important for this interpreter to be a professional interpreter as opposed to a friend or a family member. Then screening, as I said, should be routine. You should be able to identify symptoms, because sometimes the person may come to report the case months or weeks after it has happened. So the symptoms that we are likely to see are symptoms of maybe PTSD, post-traumatic stress disorder, anxiety disorder, and you may find that we may treat the particular disorder without addressing the underlying issue, which is the violence that this person is going through. The survivor should also be evaluated for safety and homicide risk. Remember, this is someone who feels isolated, feels lonely. It is likely that this person may decide to harm themselves. So it's also important to be able to evaluate safety, homicide risk, harm to self or even harm to others, because some people may want to also revenge on these particular perpetrators. It's also important to also note that in the hospital, sometimes we don't only treat the survivors. Sometimes we also have perpetrators who come for treatment. So how do we handle a perpetrator? How do we handle a survivor? I've explained how you are supposed to handle a survivor, but what about the perpetrator? When they come for treatment, do you chase them away? Do you call the police? No, we can't do that. So what we need to do is to ensure that we also have to ensure that there's safety for this particular perpetrator. We also need to ensure that we screen, we look out for the symptoms, we administer certain assessments, and then put the person on treatment. So it's important also to ensure that a holistic approach is used after a patient has been, the history has been taken, we've done a mental status exam, we've administered tests, we've come up with a conclusive diagnosis, then you find that a holistic approach to treatment should be ensured. This person may also need a nutritionist, remember. This person could also need a physician. This person could also need a spiritual person. So it's important to ensure that we give this kind of holistic approach. This person could also need police services. This person could need a lawyer. So it's important to incorporate all this into the treatment of the patient. So what does a mental health practitioner do? We encourage what we call storytelling. Storytelling is where we allow the patient to be able to tell their story, to heal and to feel validated. We can also tell the patient to do journaling. Journaling is a useful therapy tool which can be used as a trauma-focused approach, and it helps this person to do self-reflection, to do self-care, and even to set goals. Then another thing that we ensure that is done is social support. Remember, you will come to hospital, we are going to give you the best care, we are going to refer you to the best specialist, either a lawyer, a police, a nutritionist, a gynae, a physician. But then if you don't have support, then sometimes healing becomes a bit difficult, or it may be prolonged. So we ensure that we also ensure that we psychoeducate the family to be able to give the patient social support, because a lot of support is required in this area. If it is an organization, what can an organization do to ensure that it empowers its staff members to know how to take care of themselves? An organization can be able to do what we call psychological first aid training. This is training that is expected to equip the employees with skills on how to take care of themselves and also how to take care of others in the event that a person experiences a traumatic event. Psychological first aid will help employees to know how to listen out to the cry, listen out to the symptoms, will be able to help the employees to be able to link this, the friends, the acquaintances, the fellow colleagues to professional help. So this is basically basic skills that are imparted in employees to be able to help them to know how to handle such situations. Then, of course, we also have a number of recommended therapies that we use. So it's important to go to a professional, because a professional will know which particular therapeutic technique to use, whether it's using cognitive behavior therapy, whether it's seeking safety, whether it's using interpersonal psychotherapy, whether it's using cognitive processing therapy. So there are various types of therapies that can be used by a qualified therapist to be able to help a patient. Then there are also various assessment tools that we normally use, and these are standardized tools that have been validated. So one of the tools, for example, is Beck's hopelessness scale. This will help us to check whether there's an element of suicidality in this particular patient, so that we may be able to know how to offer treatment to this particular individual. We also have what we call a PTSD checklist. We check for any signs of trauma that this person could be going through, and it will help us to be able to determine the best kind of treatment and even the best kind of therapeutic approach to use. Then there's also a self-stigma of mental illness scale. People who have gone through gender-based violence tend to stigmatize themselves a lot. And with this kind of assessment, we're able to tell whether this person has this kind of stigma, so that we may be able to provide the appropriate treatment by creating awareness, looking at how this person can be able to get out of some of the beliefs that he or she has about stigma. Now, once a patient has been treated and discharged, the treatment doesn't end there. The treatment continues. It continues with the whole multidisciplinary team, but it's also important to be able to link the patient with a support group. But the linking is done when you feel that the patient is now in a better position to be able to be in a support group. Remember, all the other things we've been doing, we have been doing them as individual, in an individual session, but here now we move to a support group. So there are various support groups that such people, such survivors of gender-based violence can be referred to. which I have listed for you. Chiromo Mental Health Hospital is one of them, where you can be able to call a toll-free line, and someone will reach out to you, someone will be able to address your concerns, and this line operates 24/7. Other institutions also in Eldoret, in Mombasa, wherever, in almost all the 47 counties, we have support centers where people can be able to call. These are different organizations where people can be able to call and be able to get the kind of help that they need. In conclusion, I would like to say that it's important to be able to look out for each other. Remember, people who suffer gender-based violence will not come out and say exactly what they've been suffering from, what they've been going through. Sometimes you may notice certain bruises or certain physical signs in a person that shows that they have been abused in one way or another. It's important to be able to let this person know that he or she is supported, that you are there for them. Don't force the person to tell you their story because you're curious to know what happens. Ensure that you make this person as comfortable as possible to be able to disclose to you what is happening, so that you may be able to direct this person to appropriate help. If this is happening to you, then just know that there's help out there, and that there are many people who may be going through this, so do not suffer in silence. Just know that there's help out there, and this thing, if we work together, you and I, we can be able to put a stop to it. Remember, I said also in the beginning that the cases have gone up during this COVID period. Maybe it's also important at this point to be able to relook into our relationships and see the qualities that our partners have, and be able to determine whether those are qualities that we are likely to live with or not live with, so that you may do something about them, because those are some of the things that are causing conflict in very many relationships. It's also important to know how to take care of ourselves, something that we call self-care, because when you don't know how to take care of yourself, then you cannot be able to take care of another, and you're likely to engage in anger outbursts or engage in acts of aggression. So let us work together to be able to put a stop to gender-based violence, to domestic violence, to intimate partner violence. So I'll leave you with this motto: see something, say something. See something, do something. Thank you very much.